My name is Kristen Ward. I'm in Veterinary Clinical Pathology 1, and I will be demonstrating a blood draw, how to prepare a blood smear and stain that, review that under the microscope, perform a packed cell volume, and a total solids. So today I'm going to be demonstrating how to draw blood. You're going to shave the leg. Hers is already shaved. Feel for the vein. Use an alcohol swab. Let that dry a little bit.
Okay. All right, thank you.
Okay. We've got the flash. You keep this in here until it stops filling up on its own. And that is done. We'll take that out. We'll hold off, and the assistant can hold that off. Cap the needle, and then we will put her name on this immediately. Alright, next I'm going to be demonstrating how to make a blood film. We're going to invert this tube a few times to make sure everything is mixed well. And I've already got my 2 slides sitting out ready to be made. We're going to take the top off, and then you can either use a wooden applicator stick or a transfer pipette. I'm going to do the pipette this time and see how it does with this blood. Just get a small amount of blood, drop it next to the frost, put that back up, and then take your second slide, and then we're going to pull back at a 30-degree angle with just kind of minimal pressure, all the way back to the blood, forward. And then we're going to dry it. And then, I don't know if you can see that, but it does have a feathered edge at the top. So once this is dry, we'll take it and stain it with the Diff Quick stain. And then the next step in the blood film process is after it dries, you're going to stain it in the Dip Quick stains. In the first one, we're going to do about 30 seconds, and you don't need to bring it in and out, like dip it in and out. We're just going to let it sit there for 30 seconds. Okay. Then after the 30 seconds, we will let it drip, and then go to the second stain for 30 more seconds. And then after that 30 seconds, we'll let that one drip, and then put it in the last stain for 30 more seconds. After that 30 seconds, we're going to take it out, wipe the back of it off, and then we will rinse it with distilled water and let that dry, and then we'll look at it under the microscope. So the next step in the blood film process would be to review the film. We have our stained slide here. I'm going to go ahead and put it on the microscope. Turn this on. And you can briefly review the film on 100 times magnification just to look for clots and things like that, and kind of cell abnormalities. So we can briefly review that. There are a few little clots on here. After you briefly review it, you're going to go ahead and find the feathered edge. It's where the cells are unevenly distributed. And then After you find that, you will lead to the monolayer, where they become pretty evenly distributed. And that is where you will go ahead and add oil to your slide. And we're gonna look at this under oil immersion, and then that is where you will go ahead and get your relative white blood cell count. That's it. So to perform a packed cell volume, you're going to use EDTA blood. We're going to get some out with a pipette, top back on, and we'll fill up two tubes here just so they can be balanced on each side of the centrifuge. You slowly fill up your tube about 3/4 of the way, and then pack the bottom with clay. I'm going to do the same amount for the other one that you're going to balance it with. And they're about the same level. We're going to take them over here to our centrifuge. I've already taken the swinging hands off. We're going to put the clay towards the outside. We're going to put it right in the middle so they're balanced. We have our top here. Tightly close that. And then we have a button here that you have to hold that down. And then ours spins for 3 minutes. After that's finished spinning, we'll go ahead and take the top off. Get our tubes out. And then to read them, you have our little charts here. You put the clay right at the bottom, and then you want to roll it until you have the clay at 0 and then the plasma at 100. So this lines up here and that lines up there. Where your red blood cells meet the plasma is where it's going to be right at 55 for that one. Do the same for this one just to double check. And that is at 55 as well. So she's at 55%. So after you get your PCV, you can use the same tube with your sample in to get a total solids reading off of your refractometer. In the tube, you'll have your plasma and then a small buffy coat to separate the red blood cells and the plasma. You want to snap this tube right above the buffy coat, and then you'll use the sample of plasma, a small drop of that on the refractometer, and it will give you your total solids. You break that right above the buffy coat, and then using your refractometer, you can lay that on there and it should pull out its own sample. It did. We have a drop there. And on the right side of this refractometer, it has the total protein levels there. And that's how you read total solids.